and welcome to ENZYMENTAL. I'm Jason Carter. As we all know, doctors frequently prescribe a daily aspirin as a preventative against heart attack. But do you know the dangers of regular aspirin intake? You should always keep in mind that aspirin is a drug. So how does aspirin function? Aspirin cuts the risk of heart attack by interfering with the production of hormone-like chemicals in the body called prostaglandins, which regulate many of the body's vital functions. By blocking certain inflammatory prostaglandins that contribute to sticky blood, aspirin reduces clot formation. Frequent small clots over many years damage the arteries, causing arterial sclerosis, and if large clots form, the result can be a heart attack or stroke. There is an association between heart attacks and inflammation of the cardiovascular system. Excess inflammation of the heart arteries allows fatty deposits to find a better foothold, and since aspirin also diminishes inflammation, it's another protective effect against heart attack and strokes. But does this mean that aspirin is something that can prevent heart attacks? Actually, it does not. Aspirin does not prevent heart disease, nor does it reverse heart disease that's already in progress. The only way to prevent heart disease is to reduce the risk factors like poor diet, smoking, nutrient deficiencies, lack of exercise, excess weight, and other lifestyle factors. The question still remains, does the blood-thinning action of aspirin outweigh many of its known side effects? So what are the dangers of aspirin? Long after aspirin's introduction, it was discovered that aspirin decreases the production of the inflammatory hormone prostaglandins by inhibiting the COX enzyme. However, it was later understood that aspirin also inhibits the balancing and protective features of the COX enzyme. It was eventually realized that the COX enzyme is actually two separate enzymes, COX-1 and COX-2. COX-1 is essential for proper kidney function and for protecting the stomach. COX-2 is the one responsible for the production of inflammatory prostaglandins. Chronically inhibiting all COX activity, such as with long-term use of non-steroidal anti-inflammatory drugs or NSAIDs, like aspirin or ibuprofen, increases the risk of damaging critical organ systems in the body. So what are the possible consequences of aspirin intake? Aspirin inhibits cartilage repair, meaning it inhibits collagen matrix synthesis and contributes to the acceleration of cartilage destruction. Since osteoarthritis is caused by degeneration of cartilage, it appears that aspirin can accelerate the progression of this condition. Aspirin can also irritate the stomach lining and cause heartburn, pain, nausea, vomiting, and over time, more serious consequences like internal bleeding, ulcers, and also perforations in the stomach or intestines. Increased intestinal permeability or leaky gut syndrome will allow the absorption of large dietary and bacterial molecules. Ultimately, this will lead to more inflammation throughout the body. Even low doses of aspirin over long periods of time can cause serious damage. Aspirin is extremely damaging to the liver. Any damage done to the liver directly affects the body's ability to neutralize and eliminate toxins because the liver is the body's main detoxification organ. Also, the liver is important for cholesterol production and excretion, immunity, hormone balance, and much more. Aspirin suppresses white blood cells' ability to move forward, capture, and kill bacteria also. In other words, aspirin interferes with the functioning of the immune system in a way that allows bacteria more of an opportunity to reproduce and grow into dangerous infections. Regular use of aspirin also increases the risk for cataracts. Aspirin also causes increased urinary excretion of vitamin C and calcium, along with folic acid, iron, and pantothenic acid. Something that's not often discussed is the fact that aspirin and other NSAIDs also contribute greatly to osteoporosis, kidney dysfunction, and thyroid dysfunction, along with copper deficiencies, since these drugs all work by binding with copper in the body. The deficiency of copper might alter blood cholesterol and lipoprotein concentrations, and this alone will increase the development of cardiovascular disease. So what natural compounds can you take instead of aspirin that might work better for you? The foundation of overall health and heart disease once again falls on food. When examining dietary changes over the years, the biggest influence on degenerative disease has always come from an increased consumption of sugar, white flour, and oxidized fats, which are often found in hydrogenated oils, fried foods, and heated polyunsaturated oil, and also the corresponding decrease in consumption of vegetables and fruits. There are many fruits and vegetables that are naturally high in salicylic acid, which is the active ingredient in aspirin. Other supplements you can take in addition to your diet include fish oil, which contains EPA and DHA, both of which are omega-3 fatty acids. These oils have a number of health benefits, but one in particular is a reduction in blood clotting. They also have anti-inflammatory activity and can reduce the inflammation in the cardiovascular system. Vitamin E also reduces the formation of thrombin, which is an enzyme that facilitates blood clotting. A common dose for vitamin E for adults is around 400 to 800 IU per day. Garlic inhibits platelet stickiness and also increases fibrinolysis, both of which result in a slowing of blood coagulation. While some people like to eat raw garlic, there are some odor-controlled enteric-coated tablets or capsules that can be taken in the amount of around 600 to 1,000 milligrams in 2 to 3 divided doses. Ginkgo biloba has the ability to inhibit platelet aggregation, and it also regulates the tone and elasticity of blood vessels, making circulation more efficient in both large and smaller vessels in the circulatory system. And while there is no recommended dose of ginkgo biloba, a typical dose that you'll see in most supplements is around 120 to 160 milligrams per day. Green tea also reduces platelet aggregation and decreases inflammation by inhibiting the COX-2 enzyme. In fact, green tea contains more than 50 anti-inflammatory compounds, meaning that it works on inflammation from multiple directions. Drinking about 3 to 4 cups of green tea per day might be helpful. If drinking green tea doesn't really fit into your daily routine, you can always supplement with a green tea extract capsule. Turmeric reduces platelets from clumping together by inhibiting thromboxane, and it also inhibits the inflammatory effects of the COX-2 enzyme. And a standardized extract of turmeric supplies around 400 to 600 milligrams of curcumin, which is the active constituent in turmeric, and you can take this around 3 times per day in capsules or tablets. But you can also use turmeric, of course, as a spice, incorporate it into your food. Rosmarinic acid is just one compound found in rosemary that inhibits thromboxane and actively reduces platelet aggregation on its own. And it can also reduce the inflammation of the body by inhibiting the COX-2 enzyme. And while there are extract supplements of rosmarinic acid, if you want to use it using the whole herb, you can prepare a tea of rosemary by adding 2 teaspoons of the herb, which is about 10 grams, to 1 cup of hot water and allowing it to steep for around 10 to 15 minutes. One primary benefit of these natural substances is that they do not have any of the negative effects associated with aspirin. In fact, these compounds reduce someone's risk of stomach lining and liver damage and also ulcer formation, while also boosting immunity and providing nutrients, and these are all things that aspirin does not do. Remember that drugs are used to treat symptoms, not cure the underlying problem. The more we investigate the workings of drugs, the more side effects we tend to find, even with medications like aspirin that have been around for a very long time. And the only real note of caution here is that since the nutrients that I've mentioned today do affect blood clotting, you do not want to take them if you're taking Coumadin or any other prescription blood thinners. So if you are taking any of these things, you do want to talk with your doctor if you're taking aspirin or other medications before trying to incorporate or substitute any of these options. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.